We want to take the time to recognize all the amazing sponsors for the conference this year. We appreciate their support and commitment to help make this event possible. It is my distinct pleasure to introduce the facilitator for this session, Mr. Joe Claiborne. Mr. Claiborne is the Senior Manager of Business Diversity Development for the Memphis-Shelby County Airport Authority. He serves as the Disadvantaged Business Enterprise and Concessions DBE Liaison Officer. He facilitates the relationships between the airport and the contractors and consultants and the vendors. And he is a very busy man. Please welcome Mr. Joe Claiborne.
Good morning. I'm Joe Claiborne, Senior Manager of Business Diversity Development with the Memphis-Shelby County Airport Authority. I would like to thank the MBEs Continuum for inviting me to facilitate today's EDF seminar, and thank you for joining us for this annual Economic Development Forum. The theme for this year's conference is Beyond COVID, Moving Forward Together, Reshaping and Creating a Stronger Economy. This pandemic is unlike anything we've ever experienced in our lifetime. Every business has been impacted in some kind of way, and many have had to downsize, lay off employees, and even close due to the impact of COVID-19. Corporations and many organizations have taken extra safety precautions to allow employees to work remotely and with limited staff on site to safely maintain productivity. According to an online resource associated with Ernst & Young, it states that the challenge of companies is reopening in a safe and sustainable way, for which employee behavior is critical. Our behavior is critical to interacting in a safe way. Following the guidelines issued by the Center for Disease Control is the key into how we navigate through our daily lives. We all desire to return to some type of normalcy to our lives again. So what will it take for us as a society to experience some type of normalcy? According to McKinsey & Company, in a recent online webinar titled Returning to the Workplace, Lessons from Essential Businesses, as many employees come back to their workplaces and spend more time there, companies will remain vigilant, watching not for only infections and incipient outbreaks, but also changes in business performance. The webinar also covered the importance of mitigating health risks and the importance of establishing protocols and policies for employees and even customers to follow. This also includes compliance measures as well. The insight from McKinsey & Company outlines the importance of considerations that all businesses must consider at some level. During this session, you will hear from several companies that have successfully created or invented solutions to help slow the spread of COVID-19 and support the safe return to work and to reopen businesses. Although we have been impacted by the effects of the pandemic, there are still pockets of innovation that can add value to the safety and wellness of our community. Please allow me to introduce our first panelist for today's session. Debra Voss, Manager of Development of Diverse Business Solutions at International Paper. In this role, she provides strategic direction, thought leadership, and champions the development of an inclusive procurement environment by integrating diversity practices into all aspects of business. Prior to joining International Paper, Debra had leadership roles in finance and supply chain at Johnson & Johnson and Coors Brewing Company. She holds a BS in Management Information Systems from the University of Memphis and an MBA from Webster University. Joining Ms. Voss is William Troy Watson, President and Chief Executive Officer of ServiceMaster Facilities and Maintenance. In this role, he is responsible for the overall strategies and tactics used continuously to position the company for growth in order to maintain its place as the largest and most profitable ServiceMaster's clean franchise in the United States. Please welcome Ms. Debra Voss and Mr. Troy Watson.
Good morning. I'm Debra Voss with International Paper. I lead supplier diversity for the company. IP is the world's leading producer of fiber-based packaging, pulp, and paper. We have more than 50,000 employees, over 25,000 customers, and we do business in 150 countries. When the coronavirus pandemic hit, International Paper had to quickly determine how we were going to run during this pandemic. We were deemed an essential business, therefore, all of our facilities had to continue to run 24/7, with the exception of our global headquarters. Our facilities were not able to have the benefit of working from home because they had to produce the products that were desperately needed to support the food industry and the medical industry. The first thing International Paper did was to assemble a pandemic advisory committee. This team was responsible for keeping track of all of the communications coming out of the World Health Organization and the CDC, and then disseminating that information throughout the organization to our employees so that we could have the most up-to-date information on the best practices and safety guidelines that were being shared. The second thing that was formed was a COVID-19 task team. This team was charged with securing the critical PPE and services that were needed to keep our facilities running during this pandemic. Our traditional sourcing activities through MRO with our larger suppliers were becoming challenged because everyone was pulling from these same resources. And these companies were being asked to support the medical industry and the US government first. So we were having a hard time getting the critical PPE and services that were needed. So I was tapped to be a part of that task team. I had relationships with diversity suppliers where we found that these suppliers were nimble, they were flexible, and they were able to provide the items that we were having a hard time getting. One of the services that we needed was sanitization should we have an outbreak in one of our facilities. This is where our relationship with ServiceMaster facility maintenance comes in. We have been doing business with ServiceMaster for many years. They have been servicing our mills and our box plants for over 10 years. Today, they provide janitorial service to 10 to 15 mills and an additional 20 to 25 box plants for International Paper. That's our traditional janitorial service cleaning. Beyond that, with the outbreak of COVID-19, we needed stricter sanitization to kill the virus. And we enlisted ServiceMaster, a known diversity supplier of ours, who was familiar with our manufacturing process, familiar with our manufacturing facilities, familiar with our safety guidelines, and overall just familiar with the culture of IP. So it was a natural transition to have them be one of the 3 suppliers that we identified that would handle all of our facilities during this pandemic. During this pandemic, our supplier partners like ServiceMaster have been invaluable to International Paper as we continue to run uninterrupted and meet the needs of our customers.
Hello, my name is Troy Watson, President and CEO of ServiceMaster Facilities Maintenance, a leader in the janitorial service and specialty cleaning industry. We've been in this industry since 2005, operating in more than 10 states with over 700 employees. Trust has been one major component in delivering service to our customers, IP. During this pandemic, since we already serviced them, innovation kicked in my mind. We started offering electrostatic spraying, disinfecting, and helping them locate different supplies, such as sanitizers, disinfect sprays, any kind of PPE needed. Through all locations that we service IP, we were always available for all services, whether we doing electrostatic spraying, whether we doing more janitorial services, or helping with locate supplies. This has been a really great relationship, and we have really enjoyed helping them get through this pandemic and trying to get all of their employees back to work in a safe environment. We at ServiceMaster Facility Maintenance take all that we're doing very, very serious, because we're very fortunate to be in this situation, to be essential and be of service to our customers.
Thank you, Deborah and Troy. This partnership is a great example of International Paper's intentional approach to engage diverse suppliers with the capacity, infrastructure, and scale to meet the company's need, yet be responsive while providing solutions. Our next presenter, Willette Will Graham, is a distributor, and she is going to share why her product is so important to manage the impact of COVID-19. Willette Will Graham brings over 31 years of experience in quality systems, process development, and management. Will has extensive experience in development, implementation, and management of a variety of quality systems and process improvement initiatives in compliance. She holds a BS in biology and chemistry and is certified in various quality organizations. She also holds a Sigma Green Belt Quality designation. Please welcome Ms. Will Graham.
Hi, this is Will Graham. Thanks for joining me today. I'm here as the president of Global Quality Solutions International. We're located here in Memphis, Tennessee, at the corner of Old Getwell and Winchester, about 4 lights down from the airport. We're a minority-owned, female-owned company that specializes in laser marking, chemical passivation, as well as packaging for the medical device and the pharmaceutical industry. Pretty much we've been around since 2005. We started out as an automotive company, and then we moved over to medical devices in 2009. We've been in this industry in the Memphis area now for the past 14 years, and we've been at our current location. October the 9th was actually 5 years. So we're located at Winchester and Old Getwell, about 4 lights up from the Memphis airport. So we're very convenient to the 9 OEMs that are here in the Memphis area. Long story short, GQSI is the only Black female-owned special service provider to the medical device industry in not only Tennessee, not only the Mid-South, but in America. We're very proud of that. This is a very tough industry to get in, especially as a minority. We represent less than 1% of the minority of the suppliers for the medical device industry, and only about 3% for the pharmaceutical industry. Our major customers right now are OEMs and tier 1 suppliers to the OEM. How has COVID impacted our company? That's what I want to talk about today. COVID impacted us in a very big way. First of all, we had a substantial contract with a major OEM out of San Diego. I was commuting back and forth to San Diego, and suddenly, because of the pandemic, March the 2nd, that was my very last trip, and that was the end of a very nice contract. We thought it would only last about a month or maybe 2 months, but somewhere around June, we realized that we weren't getting that contract back and anytime soon. In between that March the 2nd date and that epiphany that we had in June that we weren't getting the contract back, we got a call from Malaysia, and they asked us if we would consider being the U.S. distributor for a COVID-19 antibody kit. This was somewhere around April the 4th. At this time, America hadn't even heard the term antibody. The national media had not even used the term in the newscast, and all we were talking about was PCR tests. No one had even mentioned it. As with a background in biology and chemistry, the mere fact that they said antibody, I knew immediately that, wow, that's an excellent idea to test for the antibodies. So I said, yes, we'll do it. Come to find out, the company didn't have what's called an EUA FDA approval, which is the emergency use authorization approval to distribute a medical device in the United States. So we scrambled, and we put all our resources together to get this antibody kit approved. Subsequently, it kept dragging on, and now America's talking about antibody. We need antibody. The FDA kept dragging their feet with the process to get the kit approved. In the meanwhile, we end up having another company that came after us to deliver their kits, and they had obtained the FDA EUA approval. And so we're like, we could do this. So to say all of that, we got into the antibody distribution business. And another thing that ended up happening at the same time with the antibody kits, there came a new initiative to supply blood pressure monitors, glucose meters, oximeters, and weight scales to various patients across the country through the insurance to actually help with what's called telemedicine. So as a result of that, a company came to us and asked us, can you help distribute our weight scales and our blood pressure monitors and our oximeters and our glucometers? And I said, yes. So although COVID could have taken us out of business as a minority supplier that was already struggling anyway, we're a small company. We only have about 7 people. We can go up to 10 or 11 when we need additional help for packaging and laser marking. But it represented a great opportunity for a company like us that was already in a niche market that end up having a need to accommodate the pandemic and the issues associated with the pandemic. So now we're looking at antibody kits that you could end up doing testing for the various patients to see if they've been exposed to the actual COVID-19 virus. If you have antibodies in your system, IgG or IgM, that means that you've been exposed, and it could have been asymptomatic in you and you didn't know you had it, but you could have been passing it on to various people. So that was a very good resource to have. We end up selling several thousand antibody kits, and mainly to Illinois, who was one of the first facilities to embrace us, a hospital there. So after selling the antibody kits, and next the doctors had the epiphany that using telemedicine, so they wouldn't have to have people come into the practice all the time during the pandemic, and they could actually monitor their weight, their blood sugar levels, their oxygen levels as well as their blood pressure remotely, and a red flag could go off and say, hey, your blood pressure's up, come in and see us. Hey, your sugar level was high, what are you doing? So that represented a great opportunity for us as well to end up helping the medical clinical industry, helping patients get all the information they needed to get to their various doctors to let them know that how they're doing during the pandemic. So what ended up being a crisis situation ended up being just a great opportunity, like I said, for GQSI. And I look forward to any other resources that GQSI could provide the country. Right now, you're probably hearing a buzzword called antigen. So antigen is another form of testing that's going to help in place of doing a PCR test. You could do an antigen test, and you could see if you've been exposed to COVID. We're in the process now of getting an EUA, FDA approval for that as well.
Great presentation, Ms. Will Graham. With so many unknown facts about the virus, having an antibody test conducted provides additional information about exposure to COVID. This next company saw an opportunity to create a secondary core competency by using existing capacity to pivot and manufacture a new product that could be used to protect against COVID-19. Sandra Toliver is the Chief Operations Officer for Novus Advanced Manufacturing, where her responsibilities include plant operations and procedures, establishing procedures and policies to promote company culture and vision, and maintaining control of business operations. In this critical leadership role, Sandra works with the CEO, David Hunt, to develop ongoing strategies in acquisition of steel for construction and various other uses. Sandra holds a BS in biology from Christian Brothers University and an MS in cell and molecular biology from UT Knoxville. Please welcome Ms. Toliver.
Hi, my name is Sandra Toliver, and I am the Chief Operations Officer for Novus Advanced Manufacturing. Novus Advanced Manufacturing is a cold form steel supplier of studs and track. Studs and track are the framework of any building project. They support the infrastructure of that building. With the advent of COVID-19 in March, Novus was approached to develop and build a product that would safely spray individuals with a disinfectant so that people could be able to return to group activities and be protected against COVID. With this charge, Novus set out to manufacture a steel structure that would be durable, portable, and effective. That structure was later named MIST, short for Mobile Innovative Sanitizing Terminal. MIST began as a 4-foot by 8-foot by 4-foot steel framed polycarbonate box. The box or terminal housed numerous nozzles attached to tubing and a pump. The pump, once activated, allowed the solution to be moved throughout the box in a fine mist. This mist, in turn, would engulf an individual with disinfectant upon entrance and adhere in a layer of solution that would form a barrier once dried. Today, MIST has evolved into 2 different configurations: the box or terminal, as we call it, and the MIST Express, a simple stud and track framework with nozzles and a pump that you will be able to view shortly. The toughest part for Novus was not the construction of mist. Building is what we do, but finding the perfect product to use inside it was the dilemma. The product had to be both safe and efficacious, and it had to be approved for use on the skin. After weeks of research, we found these attributes in a product called MicroSure. MicroSure is a solution that has been on the market for well over 10 years. It was developed by a group of physicians for the purpose of disinfecting implants for osteo patients. The product was so successful in alleviating intra-hospital infections that they began to study its effect on healing wounds. MicroSure is a water-based solution of silica dioxide. Its composition is 99% water, and thus it is an inert solution and can be applied harmlessly to any surface. MicroSure is now accepted by the FDA as an over-the-counter drug for use in both wound care and as a hand sanitizer. The team of physicians that developed MicroSure formed an organization called Strategia. Strategia develops biotech solutions for healthcare. Strategia then partnered with SKN Biopharma, a worldwide distribution network, in 2019. And in April of this year, the MicroSure Alliance was formed, and Novus joined in as a partner with Strategia and SKN. The goal of the MicroSure Alliance is to promote a healthier world, and we intend to do just that. As I mentioned, MIST utilizes a high-pressure aerosol technology that creates a mist of liquid particles of MicroSure to engulf an individual upon entrance. Upon exit, that individual is protected from any microorganisms that they may come in contact with. Now, keep in mind, your mask protects your nose and your mouth, but MicroSure will give you an additional barrier to reduce transmission on skin, clothing, or any personal item carried inside the terminal. MicroSure works upon contact by drying into a crystalline layer on the surface. This layer of tiny particulate solution forms a new surface made up of invisible spikes. Now just imagine your body being protected with millions of tiny needles, 1,000 times smaller than a red blood cell. That is the result of MicroSure once it dries on surface. These spikes will not allow any organism to attach because upon contact, the virus or bacteria is punctured, resulting in its death. This is referred to as a mechanical kill, unlike the more widely known chemical kill products such as Clorox or alcohol or Lysol. These products are harmful to people and to the environment. They also do not give a lasting protection as MicroSure will. Chemicals wash away or wear away, but MicroSure bonds to the surface and has to be abraded to be removed. It therefore provides an extended protection against the environment. Again, MicroSure is non-chemical based and it works by a mechanical kill. This simply means that any microorganism is prevented from replicating because it cannot attach. It dies on contact and transmission is avoided. We have provided field test units of MIST and MicroSure to the Denver Broncos. And I am so proud to say that as of today, they continue to use these products without incident. The availability of mist with MicroSure can allow us to get back to a sense of normalcy. Hopefully, our kids can get back to in-school learning. Our churches can again become a place of group solace and commune. Our homes, a place that we can share with our loved ones, our extended families. And finally, group activities such as sports and concerts will again become just plain old fun. We at Novus strive to continuously be innovative and forward-thinking. As we continue to grow our business in steel construction, we can and have been able to circumvent this time of COVID with MIST. Our goal is to help mitigate the effects of COVID. We at Novus strive to continuously be innovative and forward-thinking. As we continue to grow our business in steel construction, we can and have been able to circumvent this time of COVID with MIST. Our goal is to help mitigate the effects of COVID, and we hope that MIST and MicroSure helps in that fight. I present to you a demonstration of MIST. Stay healthy and stay safe.
The MIST and the MicroSure, when combined, provide an innovative solution to another layer of protection for added safety. Our next presenter has created a new invention that is designed to provide safety solutions related to air filtrations, which is important to reduce or slow the spread of COVID-19. Mr. Morehead is the owner of Pinnacle Restaurant Management Group, LLC. He is a franchise owner of Lenny's Grill and Subs. Prior to Lenny's Grill and Sub, Carlos has served in numerous management positions throughout his professional career, including the United States Marine Corps Aircraft Maintenance. He is retired as a Master Sergeant Aircraft Quality Assurance Director. In spite of being an established franchise owner, he decided to pivot and saw the opportunity to help combat COVID. As corporations and businesses eventually return to work, ongoing safety measures will need to be in place to continuously protect employees, and this invention may help. Please welcome Mr. Carlos Morehead.
Good afternoon. My name is Carlos Morehead. I'm the franchise owner of Lenny's Grill and Subs here in Memphis, Tennessee. And what I would like to talk to you all about is an invention that I feel has the potential to have a significant impact in industries where people having a tendency to congregate, like businesses and restaurants, and where we're having trouble going through reopenings, and there's no answer. There's no answer we're not being given any answers as to what we need to do to resolve some of these issues. And I believe that my invention has got the potential to answer a lot of these questions and give our industries a lot better peace of mind. The first thing I would like to do is I'd like to start off by briefly discussing how I came about this idea. I'm a member of an organization, it's the National Organization of Remediators and Mold Inspectors. And being a member of an organization like that, all these guys, all the folks in this industry focus on is indoor air quality. They live it and they breathe it, improving indoor air quality. My son has got an indoor air quality business. And once COVID-19 started to surface its ugly head, I began thinking about, well, what can I do to make a better restaurant to improve the air quality in the restaurant for my customers and my employees? And through collaboration with some experts at Normie, my son, who is, like I said, has got an indoor air quality business, came up with this idea. And what the idea consists of is multi-cluster ionization technology coupled with high efficiency particulate air filtration, which is HEPA air filtration. So I guess everybody wants to know what multi-cluster ionization is. Multi-cluster ionization occurs when you combine a variety of components, including ultraviolet germicidal wavelengths, with ionization, producing a powerful enhanced ion cluster capable of oxidizing volatile organic compounds, or otherwise known as VOCs, particulates, biologicals, which viruses, bacteria, fungus come under that category, not only in the air, but also on surface. The result is an ongoing sanitation process which keeps the air and those surfaces perpetually sanitized. What is high efficiency particulate air filtration? It is filtration that must offer efficiency of at least 99.97% and up to 99.99% of airborne particles, 0.3 microns in size to qualify as HEPA. So HEPA is actually the highest filtration efficiency. So what is the problem? The problem comes in with conventional HVAC units. They do not filter continuously, for one thing, and only when there is a demand for air does the unit cycle on. So you can have the best filter in the world in your conventional HVAC system, but if that system is not on, if you're in a very well insulated building and you've got the temperature set for 77 degrees and the temperature holds at 77 degrees, guess what? That air is not moving. And you've got microbes such as bacteria, fungus, and viruses, which can linger in stagnant air and or be returned to the space through recirculation of insufficiently filtered air. During periods of HVAC unit inactivity, stagnant or insufficiently filtered recirculated air may cause a potentially infectious environment in spaces where people congregate. And the healthcare community has been telling us this ever since we found out about the virus, but nobody has given us an answer for what to do about this stagnant air and what to do about this insufficiently filtered recirculated air. The Centers for Disease Control COVID-19 employer information for office buildings, updated on 9 July 2020, engineering controls recommends considering the use of high efficiency particulate air HEPA fan filtration systems to help, especially in higher risk areas. The CDC also, in prevention operating schools during COVID-19 and maintaining a healthy environment in schools, states to use high efficiency particulate air fan filtration systems to help enhance air cleaning, especially in higher risk areas such as nurses' offices and special education classrooms. So we already know that the CDC has officially put out that HEPA air filtration is what's recommended in higher risk areas. So if there's a benefit to be had in higher risk areas, there's even a greater benefit to be had in lower risk areas. Multi-cluster ionization combined with HEPA air filtration. The probe that is utilized, and I actually have this beta unit that's been in operation in my restaurant for 2.5 months now. And it's set up with a HEPA air scrubber, which is a commercial grade air purifying unit that has HEPA efficiency. And when the air scrubber is on, and a lot of this has to do with square footage, you want to get a certain amount of air exchanges per hour in a room, but the advantage to having the HEPA filtration system running continuously is that the air is being filtered continuously. And whether or not the conventional HVAC system comes on or not, you're still filtering the air through the HEPA filtration system. Now, my design also incorporates a ductwork on the exhaust end of the HEPA filter, because the air comes in, then the air's got to go out. So instead of just exhausting the air back into the space, what I've done was I've incorporated ductwork, and at approximately 6 feet, I run the ductwork up the wall in my particular operation. At about a 6-foot point, there's a cabinet that I had designed that the probe actually fits into, the MCI multi-cluster ionization probe, which also incorporates ultraviolet germicidal wavelengths, which is used in hospitals, is used on aircraft. I didn't invent the technology. The technology has been there. I just redesigned it for this purpose. So when the air actually comes out of the exhaust end of the air scrubber, which is air that has already been HEPA filtered, it again has to go past the multi-cluster ionization probe, which has got ultraviolet germicidal wavelengths. So if by chance something happens to get past that HEPA filter, the odds of it getting past this MCI probe are highly unlikely. Now, nobody can guarantee, nobody will guarantee that a system is going to be 100% effective for any virus. And the same thing holds true for this system. But the system was designed to minimize risk as much as can be possible within the confines of the space that we have to work with. Stagnant air, it eliminates stagnant air because you've got 8 to 10 air exchanges per hour. All the air in that space is moving. Nothing is hanging in the air, lingering in the air, waiting on another customer or an employee to come walking into it. Air is constantly moving. And when it gets exhausted, that air has already been HEPA filtered, and it's also going through to this MCI probe, which has the additional impact of preventing anything that may have come out of that HEPA filter. Of course, there's maintenance that's associated with the system. The HEPA filtration system has got a pre-filter. It's also got an optional charcoal filter that can be installed that'll help to greatly minimize VOCs, volatile organic compounds, like the odors that you smell when you go into a nail shop. There's a lot of advantages to this system. And I would like to say that the system is primarily designed to supplement the HVAC system, because the filtration that is going to be in 99% of all building HVAC systems at best might be able to stop mold spores. But we can't kid ourselves. It's not going to stop a virus. And in the case of a coronavirus, the size of a coronavirus is measured at approximately 0.135 microns. A HEPA filtration system has got to be able to filter down to at least 0.3 microns. Before I go, I'd like to show you a picture of the design, which is a single stack configuration. The configuration can be redesigned in multiple configurations based on the space requirements. And I would also like to thank you all very much for your consideration and for your time. Thank you very much.
Thank you, Mr. Morehead, for sharing your innovative concept to help keep the air cleaned through continuous filtration. The HVAC probe has a patent pending, so I'm sure we will hear more about that product soon. COVID-19 has allowed many of us to rethink our approach to life and also spark new ideas and concepts. We've heard some awesome presentations today. We started with Ms. Debra Voss at International Paper and Troy Watson with ServiceMaster Facilities Maintenance, who work together to ensure the safety of International Paper employees. We had some great distributors like Will Graham with GQSI, who distributes the COVID-19 antibody test kits, and Sandra Toliver with Novus Advanced Manufacturer with the MIST, along with the MicroSure nanotechnology-based product. Then also Mr. Carlos Morehead with Lenny's Grill and Subs, who invented an air purifier product that keeps airflow circulating up to 500 cubic feet per minute. I hope you all enjoyed seeing and hearing about what these minority firms have created and how they are providing solutions to combat COVID-19 and help us to maintain our health during the pandemic. First, let me thank the panelists. You have all given us a lot to think about going forward. I would like to thank MBEs Continuum and the MBDA for allowing me to serve as the facilitator, and thank you for taking time out of your busy schedule to join us this morning. We hope you enjoyed the presentations, and I ask you to stay locked in for the next session.